Welcome back, everyone. I'm Dr. Catherine Y. Brown. I'm on a journey to capture 100 voices of the pulmonary hypertension community in honor of my late mother, Roberta Baines Wheeler. Today, I'm very excited to have as my guest, Laura Hooley. Welcome, Laura.
Thank you, Catherine. Glad to be here. Glad to meet you.
Absolutely, absolutely. That's what I love about our community. Whether you're a patient, caregiver, we almost instantly become family. And I'm just
Right.
thankful to you for being willing to share your voice with everyone, probably around the world, who will view the archive of this interview. So just thank you again. I truly appreciate you.
Oh, you're very welcome. It's important.
When did you first hear the two words pulmonary hypertension?
When I was diagnosed in December of 2007, I had had congenital heart defect. So I had had, cardiology visits all of my life and a surgery very early back in the day, but never understood that this might develop into something more. And I was diagnosed at Dartmouth-Hitchcock Medical Center here in New Hampshire, and fortunate to find doctors who not only understood pH, but they, based on my heart problems, they suspected that I might develop it and was developing it. So I was one of the fortunate few who did not have to wait an awful long time for diagnosis. They figured it out pretty quickly.
Absolutely. So once they gave you the correct diagnosis, what was the road to the correct treatment like for you? Because that journey can be very different.
Yeah, sure, it's different for everyone. I was offered two different medications, one an oral pill and one a central line IV. And that was very frightening for me, that thought. And honestly, I didn't feel so ill. I wasn't in big trouble. So I opted for the pill, of course, one of the first, pill forms of treatment. And since then, over the course of, well, it's been 15 years, I have tried, I think I'm on my 11th medication. I've taken every option possible, frankly, to avoid having either subcutaneous or central line medication, because I wanted to keep my lifestyle. I was working at the time, and it was it was a lot. And I was fortunate, after many years of trial and error, and not medical error, but some drugs working better than others. I was fortunate to find just the right combination about 4 years ago.
Wonderful, wonderful. First of all, I'm glad to hear you got the right combination, because a lot of people say, and I even know my mother, just trying to get that right, as they say, the sweet spot, right? And then it can vary. There's so many factors that go into it. So excellent.
And the side effects are so tough. But I finally came to understand that I was going to have to try to push through a couple of months worth of pretty bad side effects if I wanted to give any of these drugs time to work. So that's what I did 4 years ago.
What are some of the side effects that you experienced?
The worst, well, you mentioned nausea, that, to the point where they had to have me meet with a dietitian because I lost so much weight. Most of us are trying to lose weight, but it got to the point where I was too thin, couldn't eat much. The flushing, facial flushing, headaches, horrific. And that was frightening because I had a stroke in my early 20s. And so every time I'd have a headache, I would feel like maybe, it was more than just a headache. I would lie on the couch with a dark cloth over my face. I bought gel packs. I recommend those to everybody. a cold gel pack to make you feel better. So you learn to fight the symptoms somehow.
Mhm.
I did not choose to take any additional medications, to make me feel better. I kind of didn't want to mask symptoms. I wanted to push through them.
Mm.
But my husband will tell you it was it was not easy.
Yeah, but I think what you said is really powerful, because sometimes you have to understand the symptoms, right? So that you can document it. But if you take a medication, to cure a symptom of another medication, it just kind of takes you
Right.
sometimes on a spiral. So
Compounds. Yeah.
right, yeah. So what you said is really powerful. Like sometimes just have to power through it a little bit
Yeah.
and document, so
It's right.
what's
Yeah.
happening.
Yeah. And people don't understand that, society today, and especially advertising, makes people think, oh, you take a pill and you feel better. Not always, as you
Not
know.
always. Yeah, not always the case, not always the case, yeah. So, and when you think about just your trajectory, so you got the correct treatment that
Yeah.
worked for you.
Yeah.
What is life like now for you?
Oh, so much better than over the past years, so much better. The medications have been helping me beyond what I thought that was going to happen. I was at stage 4 at one point in my pH, and really being urged to go on central line, and I was taking oxygen first just to sleep, and then sometimes as I would need it. I never showed a high oxygen concentration. I just kind of muddled through with it being in the 80s. Life now is fantastic because of a strange kind of turn of events. In 2019, my echo showed my heart was so enlarged. My right atrium was so horribly enlarged. It had always been since I was a child, but it had reached a point where the doctors were fearful. And so in the middle of COVID, I had surgery. And I mean the middle of the pandemic, not myself having COVID. I, knock on wood, hadn't had it. So I had surgery where they removed about 5 inches of my right atrium. It's basically a heart lift. They resized my heart. And I ended up with a pacemaker in my heart, tiny little thing that looks like a little battery. And after about a month's worth of recovery, I was able to walk further than I had. My oxygen saturations were coming up dramatically, to the point where probably 3 or 4 months after surgery, I called the oxygen company and told them they could take back their equipment. Yeah, that was victory.
Wonderful. That's a huge victory.
It was, yeah. My husband and I started hiking, more. Again, in New Hampshire, it's a little bit hilly, so we're still careful.
Yes.
But, pH, of course, is not gone, but so well controlled that, I don't have to think about it all the time. And so many pH patients, it's never far from them.
Yeah.
Yeah.
Laura, you know what? In RBW, we have this mantra: awareness, empowerment, hope. Together we can make a difference. To me, what you just shared, I think gives people hope, right? Yeah. And so that is really something that's great to hear that there are those instances where somebody gets that diagnosis early enough and has a team that gets them on the right, medication regime that works for them. And then when other procedures are needed, they find the right one. But then the bonus on this is that the quality of life, no oxygen, you're hiking, you're living life. And it's beautiful. So I just thank you for sharing the journey, because it's hope, and we need hope, right? Because that's not always the case for other people.
I know.
Yeah, have you seen cases where people don't get the treatment soon enough? Because that's what I see a lot of.
Oh, yeah, so often, for a variety of reasons. And let's admit it, there is still a vast variety of types of discrimination in healthcare. I'm reading about that right now. PH is primarily a condition affecting women, not always, but primarily. And complaints of shortness of breath are often met with advice, maybe well meant, about someone should change their lifestyle, change their diet, change their exercise, lose weight, all of that. That's not always the case.
Yeah.
Having grown up with heart disease, I always took care of my health and didn't smoke and, you know, did all of the things that were recommended. But as soon as someone identifies as perhaps not having the perfect type of lifestyle, things are attributed to that instead of digging a little bit deeper to see if there really is something. And all while that's happening, the person's health is deteriorating. I was hugely encouraged to read that there was a movement with infants to, at birth, before they're discharged from the hospital, to at least check their oxygen saturation.
Mhm.
You know, I was one of those blue babies and nobody knew it, you know. At the 6-week checkup, they told my mother, oh yeah, she's got a hole in her heart.
Mhm.
Simple questioning and curiosity to not make a leap to judgment about a woman's symptoms
Yeah.
would go a long way, wouldn't it?
You know what? It's so true. And I have had so many people that's the narrative is, the symptoms aren't taken as seriously as they need to.
Yeah.
And that is a problem. So, what do we need to do? What does the future look like for healthcare in general as it relates to proper diagnosis, early
Yeah.
diagnosis? Early diagnosis equals early treatment equals enhanced quality of life. What does that look like, or what should we be looking to do?
A couple sides of that, but I think one is that I think we are maybe the first generation to question doctors.
Ah,
You know, my mother's generation didn't do that. The doctor knew everything.
true.
And so I think we have to encourage everyone, but especially women,
Mhm.
to question and learn. We have a responsibility to understand our own bodies and learn about what the doctor's telling you, learn about the medications that are being recommended, understand why you're taking something, and be an active, very active partner in your treatment.
Mhm.
Because I think those patients who are more passive or disinterested or perhaps emotionally invested in their care aren't perceived the same, you know. We have to be a partner, an active partner in our healthcare, every minute, every visit, every time, ask questions, push back if we're not sure. Because the other thing that happens sometimes is the more practitioners that someone is seeing, the more differences of opinion. And I have many members in my group who have more than one serious health condition. And, you know, their rheumatologist may tell them something different than their cardiologist, and they're left wondering who to believe.
Mhm.
You have to insist that your teams come together and deal with you as one person, not, you know, kind of data on a piece of paper.
That's right. And I love what you said. Ask questions every minute, every visit, every time.
Absolutely. I go in with a list of questions still after all these years.
Absolutely. And I'm glad you said that. And so for those people that are watching, that is so important. Go in with a list of questions, but also try to jot down the responses. And then think about when you go into that next provider, if one provider has added medication, don't trust that the computer system is going to communicate it for you. You got to go in and
Yep.
have that list of medications. And if you had any side effects, because to your point, you can go to see one practitioner, right? Give it,
Yep.
I'm having this issue. They put you on a medication. You go see another one and tell them about the side effect of that, which occur because of medication, and they give you a different medication, and it
Yeah.
just goes haywire.
Yeah. And that has happened to me, and it can be detrimental to the
Yeah.
point of being dangerous. We have to, in my group, we have my PH support group. We've done a lot of awareness activities, and even to the point of inviting emergency room physicians to our meeting so that they can understand that somebody showing up in an emergency room with PH has very different needs. You know, the equipment is different, the medications are different, and the docs, maybe no fault of their own, do not deal with this very often. And so they don't quite know what to do, but you know, time counts, and they really need to raise their awareness.
True. And again, Laura, listen, I could probably talk to you all day, because I think there's so many teaching modules that people need to know that come out of it. Because the emergency room, I can recall one time going, and when you have flow land, remember you had to have the ice packs.
Yeah.
So a patient is there for a certain period of time. They need to do what? Freeze those extra ice packs.
Yeah.
And I recall them saying, well, we can bring you a bucket of, like, a little thing of ice. I said, no, I need the freezer. Well, the freezer is for staff use only. I said, this doesn't work for us, because this is going to be, so just something like that for them understanding.
That's
the
right.
patient may have some different needs, and denying access when somebody needs to freeze their ice packs is something that you can't do.
Yeah. Yeah, because they have a system and procedures. But if that's not working, somebody's at risk.
Somebody's at risk. A life is definitely at risk. And then there are some places, because the team does not know how to use the different pumps, they say you have to manage it on your own.
Yeah.
What if that patient is already having some cognitive issues because, right? And so it's like, they can't do that. It's just so many things I've seen. I've even seen, like, somebody get the wrong medication, and you like, hey, this isn't the right name on it. It just, all these things can happen, and it's dangerous.
Yeah, it is. It is.
So
I have one member of my group who was in the ER for something unrelated, but the doctor read her chart, and a resident, and then said, oh, how was that recent bout of PH that you had? Yeah.
whoa.
Yeah. I was so proud of her. She dismissed that doctor. She said, you're fired. Get me somebody else.
Correct.
Yeah. We have to, in addition to how we feel and struggle, we have to protect ourselves all the time once we're diagnosed. But as you said, even getting there can be a challenge. It's uphill.
Can be a challenge. What else do we need to do in terms of the public innovation and increasing awareness? What are we missing? Or are we doing as much as we can, or is there something else that we should be doing to raise awareness?
I think the common medical situations get all the attention, and they get all the play in the media. And people think that there's a pill to fix everything. And this is not that kind of condition. I think we do have to do exactly what you're doing, which is raise awareness of PH. I'm sure you know this. It's one of 400 plus rare diseases, and every one of those diseases is scrambling to get attention. But this one's deadly, and so we need attention to it. But it is tricky, because you can't just go by shortness of breath. Everybody has been short of breath at one point in their life, So a deeper level of understanding about what this is. People hear hypertension and they think it means you have high blood pressure. Well, yeah, we do, but not in the typical way. So awareness of what the disease itself is helps. And as a society, I think we have to increase our interest, the interest of young people in science and medicine. They're being put off from both of those things. and that's not going to help. That's not going to be a win for any of us.
For any of us. What was you say you are no longer working. What was your occupation and where are you currently living at?
Oh, I was a human resources director,
Nice.
mostly in healthcare. And I worked until about 2015. And I had to stop working because I became so cyanotic. I mean, I would do a lot of training and speaking to large groups and trying to, take medications. Are you familiar with inhaled medications like Ventavis? Yeah. I mean, I'd be sitting there huffing on Ventavis before I'd go into a room to speak to, a large group of people. And if I started talking too fast and being too animated and pacing around, next thing you know, my nose would be blue. And people were noticing that. And so, yeah, it was very hard the last couple of years to maintain sort of a public or a, business image with pH and having oxygen on and sort of all of the connotations that come with that in a business setting. Somebody walks in with an oxygen tank and the whole room changes, as you probably know.
Yeah.
Yeah. Isn't that crazy? That something that helps somebody is perceived as something fearful or something,
Yeah, we got a long way to go. Even I've heard that a lot. And even when, you have your handicap placard in the car and
Yeah.
people look at you and assume that you're just cheating on a parking spot without realizing I might not look on
Right.
the outside what my body is experiencing on the inside.
Absolutely.
So we really do have to break a lot of this, the barriers that people face. And I think it's through education and awareness.
It is. Yeah.
So you didn't tell us where do you currently reside
I
at?
live in New Hampshire. I've lived in New Hampshire for the last 30 years. I grew up in New Jersey, but have lived in New Hampshire. It's wonderful. It's rural. And right now it's 48 degrees outside and the leaves are changing and it's great.
A beautiful way to enter fall, this wonderful October. I love to hear that.
Yeah, it is.
The last question I have for you is, what words of wisdom or encouragement would you give to somebody like maybe me who's on this journey to get 100 voices? It's not as easy as people think.
It's not easy at all. I think it's captioning the sound bites that will resonate with somebody who doesn't understand pH. And, there a lot of words fly through the air. I guess your job is to grab the good ones and pull them down and put them on paper or on media so that it captures somebody's interest and they say, oh, gee, I might have known someone who had that. Let me learn a little bit more about that. And there are organizations doing a lot to try to put pH into the forefront. And I'm so glad that you're joining in that effort because it hasn't been enough so far.
Oh yeah, it's not. I tell people the power of collaboration, because it's going to take more, because all the other things appear to have collaboration. I mean,
Yes.
Tons of voices. And
Yes.
so I think we're at a point now, we've been around since 2012, right? So it's like, this is what, October 2nd, 2022, is still more work that needs to be done. It's still more awareness. And so that's what I love about the community. It's small enough that we can wrap our arms around each other. And we're at a place where we're still like word of mouth to know that somebody is safe and has good intentions. And that's the other thing that we deal with.
Right. That's right. Because there can be bad information or even bad actors out there. And I didn't know about your organization, and I think, well informed in the pH world. I'm on the board, the support group leadership board at PHA. I'm considered a go-to in my neck of the woods for pH, and I didn't know about your organization either. So Attending the events that are sponsored by PHA might help. You know, they have different events and forums. I've spoken at some.
Really?
Worthwhile doing. And the drug companies are also very interested in us. So they might have an interest in what you're doing as well. And, you know, everybody demonizes them, but look at all the research that they're doing for us. There were 2 drugs when I was diagnosed. Now there are, what, 14, 15?
It's progress.
They need to be partners in this, and they're trying. Most of them are trying.
Yeah, absolutely. You know, when we started, it's interesting you mentioned that, because when we started, we were working with mostly patients, and they were a lot of times too sick to go out and advocate. And, you know, for us, we're 100% volunteer. So
Oh, wow. Yeah.
yeah, we're 100. So we get out here, and this is a major endeavor. And so I am just excited and encouraged to have connected with you. You're stuck with me now.
Oh, sure. Yeah. Anything we can do, I'm happy to collaborate and help.
Yeah, well, thank you. And for our viewers who are watching this, you just met the amazing Laura Hooley. Please share this message so that other people can learn more about pulmonary hypertension. Again, I'm Dr. Catherine Y. Brown. Continue to follow my journey on the road to 100. I know I'm going to get there. I don't know when I'm going to get there, but eventually I will get there. And I hope you are staying tuned along the way. Thank you again for watching. Bye, everyone. Thank you, Laura.
Great. Good for you.